A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors. Is the COVID-19 pandemic in the rearview mirror, or do we have to look forward to new variants with updated precautions and new vaccines? What's happening globally and here in Western New York? On this edition of your Hometown Health Connection, we will go one-on-one with Dr. Thomas Russo from the Jacobs School of Medicine to get answers to your questions. I'm John Sciullo. Welcome to the program. Dr. Thomas Russo is a SUNY Distinguished Professor and Chief of Infectious Disease in the Department of Medicine at Jacobs School of Medicine and Biomedical Sciences. A renowned infectious disease expert, Dr. Russo cares for hospitalized patients at the Buffalo VA Medical Center. He is the recipient of numerous awards and is often quoted in national publications. He has an active, nationally funded translational research program studying antibiotic resistance to bacteria and potential new bacteria drug targets to develop a new class of antibiotics. He has been a local and national resource to educate and inform healthcare providers, the public, and businesses on how to best manage the COVID-19 pandemic, and appeared on WBBZ-TV for the first primetime interview on Buffalo television when we first heard about the coronavirus when it came into our community. So welcome, Dr. Russo, back to the program. We appreciate your time joining us for this important half hour. We have a lot to cover. I'm going to start with this. President Biden recently said that we are no longer experiencing a pandemic, yet we're still seeing all over the country about 400 deaths a day in the U.S. due to COVID. Who is dying from COVID? Are we still in a pandemic? And for those reported deaths, what age groups are we looking at? And why are there more deaths in the U.S. than any part of the country? Could it be our behavior? What can we do? What do you know about that?
Well, this is an important question, and this whole discussion about pandemic, endemic mode is a bit of semantics. The way I look at this is that if we have the tools so that we minimize the number of serious infections and hospitalizations and bad outcomes, I think then we're in a good place. And frankly speaking, we are there right now. We know that if you're vaccinated and have received all the boosters that you're eligible for, you're highly protected. We also know there's some individuals that are immunocompromised that may not respond optimally to vaccination, but we have a monoclonal antibody preparation called Evusheld, which if received can protect them up to 6 months. And if those preventative measures fail and you develop symptoms and think you may have COVID, if you get tested quickly, we have a great oral drug called Paxlovid, which can significantly decrease the likelihood that you develop severe disease and land in hospital. So we really have the tools to protect ourselves. But as you mentioned, we still have 400 plus deaths a year. And this is largely due to the individuals that have not taken advantage of those tools. So is this our behavior? It really isn't, sort in that, we are a country that has free vaccines that are widely available, but not everyone is taking advantage of that. We rank in other equivalent countries across the world with access to vaccination in the mid-60s for primary vaccination and getting our booster shots. These deaths, unfortunately, greater than 90% of them are largely preventable. And so it's sad that not everyone is taking advantage of doing what they can to protect themselves.
Dr. Russo, let's review some statistics that Annette Pinder, Buffalo Healthy Living Magazine, and others have put together. As scientists say, the virus may be weakening, yet as of August, 94 million people in the U.S. contracted COVID, a number that's likely higher since I know there's a lot of at-home tests that aren't reported. Here in Western New York, it looks like we're averaging more than 200 cases a week, and I hear of people catching COVID more and more now as we cross out of summer into the fall, and as we look at the colder weather. Is that what you're seeing?
Yeah, we have a lot of COVID here in Western New York, but as I mentioned, your best strategy is to take advantage of what's available, so then when you inevitably are exposed to this virus, the consequences will be minimal. And what I mean by that is either you develop an asymptomatic infection, are protected from infection entirely, or you develop really trivial or minimal symptoms. And we know the best way to do that is via vaccination, which really affords multiple benefits. And I just sort of want to quickly summarize what those benefits are. Our vaccines are imperfect against preventing against infection, particularly with these new variants that are somewhat invasive to our immune response. However, if you're vaccinated, you're still much less likely to get infected, and you're less likely to have severe disease. Further, if you're vaccinated, you're less likely to have long COVID, and I think maybe we could get into that in a little bit. And most importantly, vaccination with getting the appropriate boosters is highly protective against severe disease, hospitalizations, and deaths. And of course, if you're vaccinated, you're less likely to transmit disease to others. So yes, there's a lot of COVID around. Yes, we're at risk. But if you take advantage of what's available to us, we could really, as a community, try to blunt the effects of this ongoing virus that remains with us.
And the question now is, we're told that the Omicron is the most contagious, I hope I'm saying that right, the most contagious version of the virus. And now we hear about this new vaccine, the bivalent vaccine, and of course to get boosted. What is that vaccine, and how is it different than the others, and how is it preventing the severe illness and hospitalization that you just identified?
Our original vaccines were based on the strain that was isolated from Wuhan, China, in the very beginning of this pandemic. And as I think most people know, over the 2.5+ years of this ongoing pandemic, the virus has evolved. And it's evolved to, A, be more infectious, and these circulating Omicron variants are extraordinarily infectious right now. It's very easy to get infected. And they've also evolved to evade immunity that we've built up from prior infection or vaccination. Our vaccines are great in preventing severe disease and hospitalization, but they've been increasingly imperfect against preventing infection due to this immune evasion. So this new bivalent vaccine is 50% the original Wuhan strain and 50% the Omicron subvariants BA.4 and 5, which are the dominant circulating variants in our country at this time. And the hope and the logical scientific goal of this bivalent vaccine is that since it's now specifically directed against these new variants, it's going to increase the amount of protection afforded.
So Doc, is the bivalent vaccine targeting just the new strains of COVID-19, or is it targeting the old strains? And what does bivalent mean?
So bivalent means that in the formulation, 50% is the old original Wuhan strain, and 50% is directed against these new BA.4 and BA.5 Omicron subvariants.
Do you think we're going to see some new strains of COVID-19 as we move forward, as the virus emerges? And how do we know if the boosters or the vaccines would be effective against those new strains? I guess there's no way to tell until it happens.
There's no way to tell for sure. However, since this vaccine contains the most recently evolved versions of Omicron, one, it should theoretically be more effective against them. And two, right now it seems that variants yet to come are most likely going to evolve from Omicron. And therefore, having this more Omicron-specific portion of the vaccine is also hopeful that it will protect us against variants yet to come. But of course, we're just going to have to see how that plays out.
Let's talk about the age of those looking to get vaccinated. I understand that anyone ages 12 or older can now receive Pfizer's bivalent mRNA booster, and individuals 18 and up from Moderna for their booster, bivalent booster. Is there a difference between these two boosters based on the pharmaceutical companies?
There's some subtle differences between the Moderna and Pfizer vaccines, but they're not extraordinarily different. There is some data out there that suggests that if you've gotten all Pfizer vaccines and then you receive a Moderna booster, that may broaden your antibody response, and vice versa. I think one thing that's worth discussing just briefly the one fly in the ointment for these RNA vaccines, which have been extraordinarily safe and gone into billions of individuals, is that in young men, there's been uncommonly cases of transient mild myocarditis. That's more commonly seen with the original Moderna vaccine, much less commonly seen with the booster. But nonetheless, in that one particular age group, I favor using the Pfizer vaccine versus the Moderna vaccine.
Interesting, because I had the Moderna vaccine, and so I guess the next natural question, does it really matter which one you receive, or just so you receive it? And like you just said, if you had the Moderna, you can get the Pfizer, and if you had the Pfizer, you can get the Moderna.
Yeah, both of them are extraordinarily safe and efficacious. As a general rule, it probably doesn't make any difference. But as I said, there's some data that maybe if you sort of cross over, it may give you a broader response. And we're yet to establish that's truly beneficial from a clinical point of view, but there's some theoretical benefit for that.
Let's talk about the order and the wait time to receive these new boosters for those who qualify. Or does it go by age? Or was it a case when you first got the shot received? Should children ages 5 to 11 receive an additional booster? What's the timetable in terms of getting the next set of vaccines based on what maybe you had had before?
The new booster has been approved for individuals that are 12 and up for Pfizer, as we mentioned, 18 and up for Moderna, for anyone that's either 2 months out from their initial vaccination series or 2 months out from their last booster. But having said that, there's much discussion about when you should receive this booster shot. I think what we've learned so far in this pandemic is prevention against severe disease and hospitalizations. Boosters really protect us for 4 to 6 months. The duration of protection against infection is a little bit less. And so some people are suggesting perhaps that if you received your last shot only 2 or 3 months ago, perhaps you should wait until you sort of hit that 4-month mark. I certainly would suggest that anyone that's at increased risk for severe disease should wait no longer than 4 months to get their booster shot. However, they could receive it as soon as 2 months after they receive their last booster shot or initial immunization series.
Let's talk about people who have already had COVID, as I did, even after getting double vaccinated. How long should you wait until you receive the new booster, or should you get a booster? Just clarify this for me. Should I get a booster, or do I get the bivalent vaccine to go against the more contagious variant?
So to be clear now, the only booster that's available is the bivalent vaccine. So that's what you'll be receiving with your booster shot. If you've been previously infected, though we're still trying to develop an increasing body of data for optimal timing, but generally it's believed you should wait for 3 months. And if you've been previously infected and subsequently get boosted, you will develop the best immunity on this planet. So I know there's a lot of people out there that have been infected during this Omicron wave and say, aha, I've been infected, it's all good, I've got immunity from that, I don't need to get vaccinated, I don't need to get my booster shot. Well, the same way that we've learned that our vaccine-induced immunity wanes over time, and therefore that's why it would be appropriate to get boosters, at least for the most vulnerable in that 4 to 6 month time frame. That's also the case if you've been previously infected. And in fact, if you're infected early on in the pandemic with the Alpha and Delta variants, the protection against Omicron is minimal. So I can't stress enough, even if you've been infected, please go ahead and get that booster shot. You're going to have fabulous immunity and won't regret it.
I was going to ask that, Dr. Russo. Some people picked up COVID early on in its incarnation, others kind of midway through. And I guess what I'm hearing you say is you can't be lulled into the sense that you're immune just because you had it. You do need to follow up to have those vaccines so you don't get it in the future, even though the strain may be a little weaker.
Right, absolutely. And you bring up a good point. So, a lot of people say, oh, Omicron is less virulent than the earlier variants, so I don't have to worry about it. The good news is that's true, The bad news is this is still a potentially lethal virus, as we already mentioned, right? 400 plus Americans dying on a daily basis from it. So therefore, you want to optimize your protection. And the best way to do that is that after you've been infected, waiting probably at least 3 months for most individuals, go ahead and get that booster shot and you'll be in great shape.
We should point out too that from what I understand, these vaccines and booster shots are pretty readily available. They're available through your pharmacy, through your doctor's office. How is that strategy working in the availability level for these vaccines and boosters?
There is zero supply issues. The vaccines are readily available, and people should know they are free at no cost to you, whether you have health insurance or not. I love the option of getting vaccines, whether it's the COVID vaccine or my flu vaccine from the pharmacy. You can make an appointment online, by phone. For actually some vaccines, you can go ahead and walk in. Or as you stated, if you have any concerns about the vaccine or the booster and you want to have a discussion with your healthcare provider, then in a physician's office may be the best venue for you as well.
What's the testing process for these new vaccines? How do we really know? Some people will say, how do we really know that they work? And of course, the question you hear all the time, what are the side effects? And are they different from what we may have experienced with those original vaccines, with the bivalent?
Yeah, we're no longer going to be doing the huge efficacy trials that we did in the beginning of this pandemic with, 40, 50,000 individuals. We know, however, that we can measure antibody responses from smaller groups of individuals from the new vaccine formulations and assess the antibody response. And so that's what's ongoing right now with these new formulations. It's smaller groups of individuals that get vaccinated. They look at the antibody response. They look and make sure if there's no new safety signals of concern. And as I mentioned previously, these RNA vaccines are extraordinarily safe. Yes, you get those reactogenic symptoms after you get vaccinated. You might feel a little tired, headache, a little fever and achy, a mild case of the flu for a day, or many of us have nothing like myself. But those symptoms resolve very quickly, and there's really been no serious safety signals of concern.
Now, I just had a checkup a couple weeks ago, and I got a flu shot. But is it safe to get a COVID booster and a flu shot at the same time? Should there be some space in between? And I guess the question there too, are there any known risks with that vaccine when you kind of commingle the flu and COVID? They're two very separate things, are they not, Doc?
They are. They're completely two different vaccines, but we have data that shows that you could safely get both vaccines at the same time with no effect on your immune response. What I recommend is this. Both vaccines, though, do have the potential to cause those reactogenic symptoms. So if you received your COVID vaccine and it was much to do about nothing and you had no symptoms at all, then no problem getting the flu vaccine at the same time. However, when you got your COVID vaccine, you really had, a serious couch day where you kind of felt out of sorts and had these more reactogenic symptoms than maybe some individuals. You might want to go ahead and get your COVID vaccine first and then wait a week or so before you get a flu vaccine so those reactogenic symptoms won't pile on, so to speak.
I like that line. Stay on the couch day. Yeah, there you go. Now, is there anyone who should not take the vaccine? We've been talking about getting that booster, but is there a population that just should not get it at all?
Yeah, the only individuals that really should not get these vaccines are those that have had a severe allergic reaction to the vaccine previously. Such individuals should go ahead and reach out to an allergist and determine if there's an alternative formulation or they could receive the vaccine under special monitoring conditions. But that really only applies to a very, very small fraction of individuals. And the overwhelming majority of individuals have no contraindication, no medical contraindication for getting these vaccines.
You and your peers are saying Omicron is a milder, less deadly variant, but it can still come obviously with severe illness and you don't want to risk that. But do you think there were going to be more strains that emerge? We often hear anecdotally about how this is changing and taking its different complexities. And Is it going to change, and hopefully is it going to weaken as it changes? What do you anticipate this winter? Are we going to see it weaken and just become a part of our life, as you just mentioned with getting our vaccinations? Or, God forbid, do we see some uptick and something stronger come about?
Well, that's really the million-dollar question, right? There's no question in my mind that we are going to see an uptick in cases this winter. The virus that causes COVID is a winter respiratory virus, and the flu season is coming up. And when we cooler weather, when we're indoors, that's when the virus spreads less. I also think there's little doubt that the virus is going to continue to evolve. Really, what we don't know, though, is it will continue to evolve to cause less severe disease, which we hope for. However, that's not necessarily guaranteed, and it's a possibility that a new variant may evolve that causes more severe disease. We hope that's not the case, but that's why it's critical to have ongoing surveillance and assess where we're at over time. Right now, we've got the tools that really are ideally situated to protect ourselves against the variants that exist. What we hope doesn't evolve is a variant that could cause both severe disease and evade the immunity wall that we're building at this time. Let's hope that doesn't happen, but we need to remain vigilant, and we can't become lackadaisical.
I will say it's very easy to become lackadaisical because you just want to forget it and move back into the kind of life that we had prior to the pandemic. Talk to me about long COVID, Dr. Russo. We hear about that a lot with people who have had it, and they seem to have, they're not positive for COVID, but they seem to have complications that are like COVID that last for a long time. What are you seeing in these patients, and what is long COVID?
Yeah, long COVID, I think, is really going to be the next great medical challenge that's a consequence of this pandemic. Unfortunately, we're still learning a lot about long COVID, but simply stated, it's individuals that have been infected have symptoms that last for months, and in some cases, even greater than a year after their infection. I won't bore you with the details of the symptoms, but the most common symptoms tend to be some combination of fatigue, brain fog, which is some mild cognitive dysfunction. They could have difficulties in terms of their breathing, a decreased exercise capacity. Virtually any organs in our body can be affected by COVID, and the long-term consequences could be really quite significant beyond the acute infection. And that's why I can't stress enough the importance of protecting yourself with vaccination and those other measures we discussed, because we know that'll decrease the likelihood of you developing long COVID. It is obviously could be potentially disabling and keep people out of work and really change their lifestyle. So what causes long COVID, what the mechanism is a work in progress. And presently, we don't have any treatments for long COVID as well. I think it's worth mentioning that University of Buffalo has developed a long COVID registry. You could go to our website and find that, and we're welcoming people that have had COVID, whether they developed long COVID or not, to register so we could learn more about this particular consequence of COVID infection, improve our diagnostic modalities, and develop new treatments to help this increasing body of individuals that really have these disabling and problematic symptoms.
I think that's important information you just gave us there, that people have a resource now to get their information in that portal so that people can find out what's going on and collectively share it. I would suspect that when you see that information, you may find out about somebody in Western New York that has a certain situation of long COVID, and you compare that to other cases. Is that true?
That's true. We could learn more about long COVID in terms of how to both diagnose it. We don't have a specific diagnostic test for long COVID. And as treatment possibilities arise, then we have individuals with certain symptom complexes that if they're interested in a research trial, they could potentially benefit themselves and obviously increase our overall knowledge to help other individuals.
We have about 3 minutes left, Dr. Russo. Early on, I remember seeing reports out of Italy, and we saw things that were happening across the world. What's happening across the world now? Is there something we should be looking out for that would give us some indication as to what might be coming?
Cases are decreasing similar to this country. They're decreasing across the world right now. However, I think this is the eye of the storm. I think that cases will increase as we head into this winter season, and therefore the importance of people going ahead and getting that booster shot to maximize their protection and do those other measures that we talked about. I'm hoping that the winter surge we have this year will be significantly less than that Omicron wave that we witnessed this last winter, which was really quite significant. And I think it will be, since we're building our immunity wall from the combination of prior infection and vaccination. And as I said, hopefully people will embrace this new booster. And of course, the hope is that variant that we already discussed that could evade this immunity that we're building and cause severe disease. Let's hope it does not emerge. And if that turns out the case, I suspect over time, we're going to do better and better with this virus, but unfortunately is not going away. And so we need to do everything we can to protect ourselves and minimize its impact.
One more quick question, Doc. How do we dispel misinformation that's out there? I mean, we just had a wonderful half hour and learned so much with you, but there's a lot of stuff out there that's dangerous. How do we make sense of what we hear and see and read online, and which resources do we trust?
So, let me lead with, do not trust anything on social media. Social media is a great source for lots of information, but there's a lot of accurate and inaccurate information on social media that's not curated, and it's really difficult to sort out. My best advice is to use trusted sources. The CDC has lots of great information, but I appreciate some people would like to get information outside of a government body. So I suggest other sources such as New England Journal of Medicine, Johns Hopkins, and a variety of other academic institutions as well have great online resources if you feel more comfortable with a non-government source of information.
I recall Johns Hopkins University, if I'm recalling it correctly, were the portal for all of the statistics on the cases, deaths, and reported cases. Am I right in remembering that, Dr.
Yeah, they've
Russo?
been invaluable in helping us track the number of cases and outcomes in this pandemic. And it's a great academic institution and a great resource.
Well, thank you for joining us, Dr. Russo, and the important information about COVID and the bivalent vaccine. And we hope to see you again soon here on the program.
Yeah, thanks for having me. My pleasure.
If you want to know more about COVID, remember what Dr. Russo said. You can reach out to your primary care or trusted physician. Plus, you can also get some important information from very credible websites like the Johns Hopkins University Coronavirus Center at coronavirus.jhu.edu. Here's another one, the Centers for Disease Control at cdc.gov. The World Health Organization has a unique website. It's who.int. The New York State Department of Health, coronavirus.health.ny.gov, and Vaccine Finder at vaccines.gov. Remember to make sure that you seek valid and vetted medical information online and from your trusted source. I'm John Sciullo. On behalf of Buffalo Healthy Living Magazine, thanks for watching. Be safe and be well. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.